Hi students, welcome to this new video of oral pathology. We are discussing about soft tissue lesions, right? So this is a short video regarding hemangioma and vascular malformation. See, I have to clear you a concept in hemangioma and vascular malformation. This is very simple. They ask question in hemangiomas and vascular malformation. That just the concept is important here. Okay, there is no need to by heart anything. You should understand what is the difference between hemangioma and a vascular malformation. So hemangioma and versus vascular malformation. Okay, you may have seen this term, and you will see these terms in the options also: hemangioma, vascular malformation. So what is the main difference is that hemangioma is a true benign tumor. It is a real benign tumor of your blood vessels. Okay, your endothelial cells. Endothelial blood vessel cells. Okay, endothelial cells are the cells which line the blood vessels, right? So endothelial cells are the cells which line the blood vessels, and this is a true tumor. Hemangioma is a true tumor of your endothelial cells, and you can see in hemangioma there will be large proliferation of this blood vessels. There will be proliferation of blood vessels. You see so much of endothelial cells in this. So you see so much of blood vessels along with the sheets of this endothelial cells. So that is hemangioma. So hemangioma usually occurs after birth. They occur after birth. So it usually seen after 6 months. In after 6 months. So when the child is born, and when the child's vascular system develops, and this hemangioma start appear in the late stages, means it's like it is not seen at the time of birth. It is seen after birth, and near to 3 to 6 months of age it will start appearing. Okay, vascular malformation on the other hand, it is just a structural abnormality. Okay, structural or anatomical abnormality. So there is no proliferation here. Okay, abnormality. There is no proliferation. There is no proliferation of blood vessels here. There is no proliferation of endothelial cells here. Okay, it is not a benign tumor. Vascular malformation is just a structural abnormality, and there is no endothelial cell proliferation here. No endothelial cell which is proliferating here. And what is the thing is that this is seen at the time of birth. Seen at time of birth. Okay, time of birth. So this vascular malformation, you can see it as soon as the child is born. Okay, and the fate of these lesions, hemangiomas usually have a phase of growth. Means it will be growing for some time. It will be then stable for some time. After that it will show a resolution. Means it will resolve by its own by the age of 5 years of age. 5 years of age, when the child attains 5 to 6 years of age, this hemangioma resolve. Means it will resolve by its own. Okay, that is hemangioma. That's a feature of hemangioma. So hemangioma is a benign lesion. Okay, it is mainly seen at in the childhood, but after birth to 3 to 6 months of age, there is endothelial cell proliferation here. That's a benign, so true benign tumor of your endothelial cell, and it will resolve by its own. But vascular malformation is just a structural abnormality of the blood vessel. There is no endothelial proliferation here, and it is seen at the time of birth, and it will not resolve. Will not resolve means it will be persistent throughout the life. Okay, so this is the main difference, and you can see this hemangioma, different types of hemangioma. That is capillary. If the blood vessel uh, capillary is involved, capillaries are involved, we call it capillary hemangioma. If veins are involved, we say cavernous hemangioma. Okay, capillary hemangioma, cavernous hemangioma. If the arteries are involved, we say arterial hemangiomas. Okay, and same applies for your vascular malformation. Okay, venous malformation, arterial malformation. Okay, and based on flow, this is based on vessel. Okay, which vessel it is involved, based on flow of blood in this. Okay, based on flow of blood in this, there is two types: high flow and low flow. Means based on the flow, how much amount of blood. If it is larger, then it's high flow, and if it is smaller, it is low flow. Same applies for your vascular malformation also. Okay, so this capillary hemangiomas. Okay, capillary hemangioma are called your strawberry angiomas. Capillary hemangiomas are called your strawberry angiomas. Strawberry, because it will look like a strawberry. Strawberry angioma. Now, there was a question in your previous NEET paper that how can you identify or a marker? How can you identify this capillary hemangiomas? Or how can you identify these hemangiomas? And how can you demonstrate it with a marker? Which is a marker which comes positive? A ISC marker which comes positive in this hemangiomas. So that marker is GLUT1. GLUT1, and that is positive in your infantile hemangiomas. Infantile hemangiomas. This is a previous question of your NEET. In the NEET, they have asked this question, which is the marker for this infantile hemangiomas. That is GLUT1. Just remember GLUT1. GLUT1 is related to your hemangiomas. Okay, so this is about a little about your hemangiomas. Now there is one more blood vessel, one more vascular structure, that is your lymph. Okay, the lymphatic channels. Now, if a defect occurs in the lymphatic channels, it's called lymphangiomas. Okay, so can you see in this picture? What is this picture? Okay, please listen, look at this very carefully. Okay, you can see the tongue of this person, and it is having many large enlarged pebbly surfaces on the tongue. Okay, so you will feel that this is a hemangioma because of the red in color. No, this is not a hemangioma. This is called a lymphangioma. Lymphangioma, because hemangiomas usually comes in the lips. Okay, hemangiomas, the most common site for hemangiomas are the lips, while the tongue is very favorite site for lymphangioma. These are all enlarged lymphatic channels. Enlarged lymphatic channels. Okay, lymphatic channels. So please remember this question. This is the image based question. Please note this is an IBQ. Okay, this is an IBQ. Previously asked in two papers to NEET continuously. It is asking 2 years. Okay, in 2022 and I think in 2023 NEET papers it was asked the same picture, the clinical picture that was asked. We will see the question. Okay, so this was asked in your NEET examination. See the tongue, the location is tongue. Lymphangiomas most commonly it comes in the tongue, where hemangiomas comes in the lips. Okay, so this appearance is called a pebbly appearance or frog egg appearance. Frog egg appearance. Now, I think if you remember our chapter when we discussed congenital abnormalities or developmental anomalies of the tongue, we have discussed about macroglossia. In macroglossia, we told that lymphangiomas. Okay, the pebbly enlargement of the tongue. Okay, if you remember, if you are not remembering, please revise our video on congenital abnormalities and see those things we have discussed there. Okay, this pebbly appearance on the tongue and pebbly enlargement of the tongue, lymphangiomas. Okay, revision is the key. Okay, and this is a histological appearance where you can see large lymphatic channels. Okay, these large lymphatic channels are the channels which you see. Okay, those are the swellings you see on the tongue. Okay, what you see here. Okay, that is all this large lymphatic channels. Okay, so this is about your hemangiomas and lymphangiomas and vascular malformation. I hope you got the concept clear. What is hemangioma and what is lymphangioma and what is vascular malformation. Okay, so see you in the next video with a new topic.